This video is about a tibial osteotomy and what you can expect, a little bit of tips and tricks. There's a lot of information here. I am a patient. I am not a doctor. I have had a tibial osteotomy on this leg about 11 years ago for the same condition. I was bow-legged in both legs. This one has progressed and I've just recently had this one done. As you can see, I'm still in my Taylor spatial frame or a halo or whatever you want to call it. This will be on for about another 2 weeks or so. It's been on since January the 3rd, and it is currently July 18th, and I will probably get this off in about 2 weeks. It feels about right to get it off just from feeling it. I'm going to go through a couple of videos. This video is really on all the tips and tricks that I've learned over the past 6 months. And then I'll get into, in another video, a little bit about the mental side of it, a little bit about the physical and pain management side of it. But I just really wanted to throw this video out there for some real quick tips and tricks on what to do and what not to do when you have one of these contraptions put on your leg. The first thing that I want to go through is just the physical part of it. Don't touch any of the pin sites with your hands, ever. I mean, ever. When you get the bandages on after you go to the hospital, just leave those bandages on. Don't touch them. Don't mess with them. Don't pick at them. Don't do anything with them. Anytime you put your fingers on your pin sites, you're putting germs onto your pin sites. I learned it from this side. Anytime I messed with it, it always got infected. Always started oozing. I haven't had any oozing with this since day one, besides the little bit of blood that came out when they put the pins in. But I have been very adamant not to touch it, not to pick at it, not to do anything with it. If you're going to do anything and you need to get to it, go buy yourself some Costco gloves, put the gloves on and do that. That's the best thing you can do. The other thing that I would highly recommend is when you're in the shower, go get yourself some Hibiclens. This is antiseptic soap. Just put it in your hands, soap it up, and then put your fingers around the pin sites and go ahead and soap it up. Don't use it on your whole body. This will dry everything out, but it certainly helps with the infections. The other stuff that they give you is this, I don't even know how to say it, it's mupirocin ointment and just the regular antibiotic ointment. Oh, there's the other one. I find this is really useful when I do have some sort of irritation there. It does work really well. But it also, I think, tends to make my skin a little bit irritable. So I use it sparingly, but it is a very good ointment. It's also good when you cut yourself on these, from these pin sites, you put it on your skin and it really helps clear that up. But I use this probably more than I use this Muprocin cream. Again, never touch this. Just keep your hands off of it. I don't care if it's hurting or if there's something, just keep your hands off of it. The other thing that I want to really quickly go over is when you feel around the pin sites, it gets hot, like it's really irritating. Something's on it. So take your cream, take it to the sink, rinse your leg off, go ahead and soak this down and rinse it off and then towel dry it and then go ahead and put that cream on it and leave it alone. This will get irritated off of everything. Pollen if I'm walking, dirt if I'm outside, anything gets on this, it starts to burn. I mean, the outside starts to get red and it starts to burn. So it's very, very sensitive to anything for me. So I would highly recommend it. I didn't do that when I had this leg done, and I always had infections on the bottom pins, and it was very irritating and painful. This one I made it just a conscious effort not to touch it, and it was good. I want to point out a little bit about clothing and what you can do to cover it up. I mean, obviously people want to cover these things up. The first thing is one of these. These are neck warmers. You get these for skiing. You keep your neck warm with them. They're fine for that, but you can get them all different varieties and colors, but they also work really well to cover up your fixator. Now this one, I have a whole bunch of these lying around. This one in particular I just pulled out of the laundry, but it does a good job covering it up if you're a little self-conscious in public. Keeps people from gawking too much. Obviously they'll gawk at this, but they won't really know what's on it and go, ew, what's that? I have varied reactions to the fixator. I have reactions from people at Costco that say, why are you still in the hospital? I'm not going to stay in the hospital for 6 months. And then I have other people who, like when I do go swimming now, but the only swimming I do is treading water because I can't kick my legs together. And then for about 45 minutes I do that. But the old folks are like, oh, I haven't seen one of those in years. Oh, I'm glad you're here at the pool. It's good to see you. It's like, yeah, I remember my friend had one of those. Or, you know, my daughter had one of those when she was a little kid. So, you know, you get all different types of reactions. As these are on longer, you tend to get a little less self-conscious about it being on. I really don't cover it up anymore when I go to the store. I'm up to here with it being on. So I just don't give a shit anymore, excuse my language. But I'm just going to walk around in public as if nothing happened. If it was a formal event or a company event, I would probably put something over it. But besides that, I don't really do much to it. The other thing that you can do is go get yourself a pair of pants, custom made. So these I had custom made. They have a panel that's sewed into it. You can see the panel here. It's a regular pair of jeans, but this huge panel is sewed into this with a zipper all the way up to the side. And these have been really good if you need to go to work or you need to get out in public. They cover up fixator just great with one pant leg doing fine. They're not cheap to make. But if you have someone who's good at sewing, then you should make one of these. In another video, what I'm going to do is I'm going to just take a dimension of what this looks like. I'm a 34 waist, 34 length, so I'm about 6'2", but I'll take a dimension of what this panel really looks like and how far it's sewn in, just so you have an idea of making a pair of pants if someone wants to make it for you or whatever. Don't use a really heavy zipper because it gets in the way. This is just a regular zipper that you would see on shorts and stuff. But I had a pair of these made. I have 2 pairs of these made this time, and then I had 2 pair made last time, and I think it was like $150 last time. I think this time it was like $250. So it does get costly, but I tell you what, sure is nice to wear pants. The other thing I can recommend is go to Costco or Target or Walmart, buy yourself a cheap pair of sweatpants and chop off one leg, and there you go. One leg stays nice and warm, and the other leg stays nice and freezing. But you know what? It's nice to wear a pair of pants. So I would recommend doing that as well. The other one is take home your hospital shorts. I wore these for such a long time. And now I don't want to think about the hospital anymore, so I don't wear them anymore, but that's a good thing as well. Any shorts work great. Swim shorts work really good because they're really stretchy. Find any pairs of shorts that have just a little bit of elastic in them. They'll fit over the fixator. Yeah, it's kind of hard sometimes. What I find is that since this fixator is more pointy at the front, if you leave the back end off, pull it over the front, pull up the back end, and then do the opposite, pull over the back end and lift up the front, it works really well. Always put your fixator pant leg on first. Like any fixator, you can't bend your leg all the way, so you're not going to be able to really get down there and put it over your leg. So that's what I would recommend to do that. If you're just coming out of the hospital, if you're on medication, you're always going to be cold. It's just one of the nature of one part of the medication. And I'll have a medication video because medication is a big deal. Go get yourself lots of hats and wear a hat around the house. It'll save you. It's no fun being uncomfortable with your leg being in pain and also with the hat. I am not in any pain right now. Haven't been in any pain for probably the last maybe 3 weeks, as the bone is healed and it's been set. And I'm just waiting for my appointment next week to find a plan to take it off. But those hats are wonderful. All right, those were the quick things that I wanted to point out just on this. If you have questions on what a fixator, you're always going to be, what the hell is that? It's like, well, it's just a fixator. Well, why do you have it? It's like, well, because I was bow-legged and my inside of my knee wore out and I really couldn't walk anymore. And rather than replace the knee, they choose to move the foot over by cutting the tibia and moving the foot over and getting the weight over the center of the knee again, rather than having the weight when you're bow-legged over the inside of the knee where your tendons are holding up. You kind of wear out that just that small portion of the joint. The rest of your knee is just fine, so go ahead and move it over. When I had this one done, I had 3 doctors tell me that I should have a knee replacement. I think there was a 49ers doctor, a bunch of other doctors, and I went to Stanford, and he's like, why would you want to do that? He goes, you know, you're a young guy. I think at this one I was 44. I'm 55 today. At 44, he's like, you don't want to replace the knee? He goes, once you chop the knee up, your knee's gone. He goes, those knee replacements last about 15 years. He goes, then you're going to be caused with a lot of problems. He goes, wait as long as you can, and then get a knee replacement when you need to. So I chose that route. It's a painful route, but I think it's a better route, at least in my case, for sure. And same with this one. I've had wonderful experience with this over the past 11 years. And I'm glad I did it. As you can see, you can still see the holes in the leg, but I tell you what, it's nice to have a knee. I can get a knee replacement when I want to in the future, so I'm glad with that. All right, that's it for this video, and I'll have a couple more that kind of go over a